So I think I understand what's going on, Mr. Campbell, at this point. You really started off with this acute back pain that over time became chronic in nature, and you said it was consistent, always there, radiating towards your buttock, and really interfered with your ability to work, to do the things that you love to do, like play tennis, to do your outdoor activities and working in the garden, things like that, and not really being able to take your wife out on dates and things like that. At first, the oxycodone was helping you that you got from the first doctor, but it was tapered off very quickly. The second doctor said, no, we don't do this anymore. And it sounded like it pushed you in a situation where you started to buy the oxycodone from the streets, but it really just got too expensive and you switched over to the heroin. And now you really feel like you're backed into a corner where you don't want to use the heroin. That's not how you see yourself, but at the same time, it is helping your pain. Does that sound accurate?
Yeah, and that's
Okay.
right. Well, actually, I stopped the heroin, and you know, I'm buying the oxy again. But that's why I'm you know, seeing you. I want you know, I want some professional help. I'd like to you know, get it prescribed and help help me, you know, taper off.
Well, I can definitely tell you, Mr. Campbell, that we're here to help, and you've come to the right place, and we can help you, okay? It'll be important for me to just have a better understanding of your opioid use, okay? So I'm going to ask you some questions about that. You mentioned that you would have to take larger doses of the oxycodone over a longer period of time. Is that true?
Yeah, that's true.
Yeah. And now that you're finding it more difficult to really cut down or control your opioid use?
Well, like I said, I stopped the heroin.
Yeah.
And even though it's, you know, costing me a ton of money a day, I'm you know, I went back and I'm buying the oxy. I'm buying it on the street, but I'm trying to taper myself down. I mean, I just, you know, I don't like the way, I don't see myself as a I don't like seeing myself as a heroin user. And,
Right.
And I mean, I just wish I could get legally prescribed medication to help me with my back problem.
Yeah. And we will. Again, I just need to make sure that I have a clear understanding of exactly what's going on. Do you feel like you're spending a lot of time managing the pain and trying to get the opioids to buy to help you with your pain?
Well, the heroin was really problematic. I mean, yeah, I found myself, you know, leaving the house to try to, you know, to have to score during the day, and I mean, of course, I never told my wife that I was using heroin, so I had, you know, to hide it.
So in that way, it's affecting interpersonal relationships because you have to hide from your wife what's really going on.
Yeah, and I mean, just the money that I've spent over the years on it. I mean, it's like I said, it just makes me sick. Yeah, I mean, we started. I mean, you know, we argue a little about money and finances, and I mean, I just don't like the way it makes me feel too. I mean, you know, I'm having.
What about work? Are you having some problems out in that area, or?
Well, I am having issues at work. I mean, I have trouble, not even just with motivation or even with concentration.
Wow.
Yeah.
On top of the activities you had to give up that we already mentioned, your tennis and working in the yard.
Well, I mean, I had a situation at work.
Okay.
That was about a month ago. A bunch of us were in New York on a business trip. It was a week-long convention, and you know, I was still using the heroin then, and I knew I was going to be away, so I brought some with me. You know, strange city. I didn't want to be stuck without it, and I didn't really know where I could reliably get it. And anyway, you know, throughout the course of this week, well, I ran out. And, you know, I ran out about midweek, and you know, another day or so. I mean, I started. You know, I had headaches, I was nauseous, I'm sweating.
So really those withdrawal symptoms you're experiencing.
Diarrhea. I mean, I just, I mean, what I, and you know, I feel bad. I'm ashamed. I mean, I told my boss, I said, hey, I'm coming down with the flu, and I had to go, go back home, and I had to score again.
Yeah.
I mean, it's kind of a wake-up call for me, really.
Yeah.
And that's, I mean, I just wanted to tape. That's why I started buying the Oxy again, because I figured it would be an easier way for me to, taper down.
Yeah, no, you're definitely describing kind of what we call tolerance, taking the medication for a while, and then when you don't have it, your body really does go into withdrawal, kind of what you are describing. And it sounds like, too, Mr. Campbell, you were having intense cravings for the opioids as well.
It was pretty intense, yeah.
Yeah. Can I ask, were there any situations that when you were using the opioids that you were driving or doing things where you put yourself in a hazardous situation or anything like that?
Did I drive? Yeah, I mean, of course I drove. Yeah, I mean, I had to drive.
Yeah, yeah. And what about any kind of medical or psychiatric problems as a result of your opioid use? Like trouble concentrating or problems with your sleep, things like that?
Well, I definitely have trouble sleeping. I mean, just with the pain, I've had trouble sleeping, and I mean, yeah. I mean, I have trouble concentrating at work. I mean, when I left that convention, I missed a couple of projects that came up that I really wanted to work on, and I feel bad about that, and I missed a couple of deadlines, and I mean, yeah, there's a lot of stuff like that going on.
So, Mr. Campbell, again, I appreciate you being open and honest with me, but I can definitely tell you at this point, based on the information that we have so far, you definitely meet criteria for what's called an opioid use disorder. Okay? And
so what does that mean?
Yeah, I know it's hard to hear disorder, that word, but basically means that you've lost control. And you definitely don't want to be doing the things that you're doing. And as a result of the opioid use, you're not functioning at a place where you need to.
Well, how am I supposed to manage my back pain without having some pain medication?
Yeah. No, I hear you. And again, I'm here to help. So I'm on your side. And I can only imagine how frustrating it is. One of the things that we can do is talk about some medications that not only will work for your back pain, but also for you losing control as a result of this opioid use disorder, okay?
Some other pain medications?
Again, these medications can be used for pain, but they're also used for when people are losing control as a result of their opioid use. So for you, it would be really good because it can treat your chronic pain and also the loss of control that you've been having with getting the opioids.